This exercise is a movement snack. I'm really impressed by how quickly they make big changes in the body. So they're neurology-based exercises, so they're neural retraining exercises. They affect the brain map. So the brain map is above the ear in the brain on either side of the head. So it's a map of how the brain is reading the body. So when we affect neurology, it means we can influence the entire body very fast. So these exercises look weird, they look silly, but I'm amazed by how effective they are for different aches and pains. So do before and after testing to see how it is for you in terms of are you increasing range of motion or not? Is it making your system tighter? And does the pain area or ache or stiffness, does that feel different after 2 minutes? Okay, so let's do a couple of range of motion things first. So the easiest one is just turning your head side to side. So just noticing how far you can turn. Is there more range? Can you turn more on one side versus the other? And where's the tension? So for me, it's up in here on this side. When I turn this way, it's up in here and a little bit on this side too. So I'm just noting that. Your arms come up to the side, so thumbs to the roof, arms come up to the side. What happens with that? Is it painful? Do you pinch up? Does it pinch at a certain point? Does it get tight somewhere? Notice that. As long as your back's okay, bend forward like you're to touch your toes. See how far down you can go. Where's it tight? Is one hamstring tighter than the other? So your legs stay straight when you do this. Then bend your knees, come back up. And then bend backwards. How does that feel? Is it a bit pinchy? Is it sore? How much movement do you have? And the last one is you lock your fingers together like you're James Bond, like that. Arms stay locked, feet straight ahead. And then you're turning as far as you can, keeping the arms straight. So notice how far you can turn, Then you might be able to turn one side more than the other already. If you have hip issues, lay on the floor with your feet pointing to the roof. Then you bring one ankle on just above your knee, and you notice how that feels in that side hip. Where is it sore? Where is it restricted? Is it stretchy? Is it painful? And notice how high the knee is from the ground. Okay, so notice that. And then do the other side. So you're just doing a comparison. Notice, is that knee a lot lower or higher? And is it sore or tight in the same place or somewhere different? Notice that. Then do the exercise. Do the exercise for 2 minutes, recheck, and it's worthwhile doing 2 to 3 sets of the exercise and then rechecking that again as well. So you're starting off with this penguin march. Okay, so the movement's coming from my hip. So I'm actually hiking my hip each time and my legs are staying straight. So I'm not locking my legs out. They're just naturally straight. What I'm not doing is bending. So people bend the knees like this. That's not it. Your legs stay straight. So the movement has to come from your hip. And I'm lifting my feet like this, like that. So I'm not doing this. So the feet stay like as if they're standing on the floor. So we've got that first. Okay, so there's a lot happening inside that. So usually within a minute to 2 minutes, you can get quite fatigued in the back of the pelvis, the sides of the hips here too. So it's helping or working with muscle endurance of the glutes and the go-go muscles. And you'll notice as I'm doing this, see how my head goes side to side? So the atlas, the top of the vertebra, it has to adjust quite a bit just for the exercise. Okay, so the brain's recalibrating all the time. So that's the first part. And then we get one arm, can be either arm, and I'm pushing my hand into my head. So I'm staying nice and tall through my body. And I'm pushing with maybe 10 to 20% strength. So I'm not trying to push my head off, but it gives me more input into the neck muscles here. So the brain has more input going through and the brain loves having more input. So we're getting some joints moving, but it's really the input. And now my hips are getting more fatigued now, and part of it's the input coming from my neck. And I'm just relaxed, breathing, I'm not holding my breath. I'm relaxing into this movement. Legs still staying straight. My head's still straight. I'm not doing this or this, staying straight. And then we have a recheck. So that's a lot more movement, hardly any tension at all. It's changed there, but still a bit tight this side. So it makes sense because I trained this part of the neck. Arms, way looser. Hemis, a lot more movement. That's a lot easier too. Feet straight, interlock the fingers like a gun. So there's more movement. I've probably got 20 degrees more as well. And that's 2 minutes. I've done no stretching. So this is the Faber test for the hip. So it's a test for the hip joint. So the knee's sitting lower and the tension's different in the knee, in the hip. And that's sitting lower too, the tension's different. So a way that you can work out which hand to use, it doesn't matter. You just play with it. One day you do this hand, next day you do this hand. You do one set here, one set on the other side. Might even do another set where you use this hand again. So you're playing with the neurology in your body and you're seeing what seems to work best for you. And if you're not sure, just do either one or do both. Do a set of this, set of that. You may find is that if you have a lot of people when they stand, they have a knee that wants to stay a bit bent. It means that that hip is usually a bit higher, or there's a dural drag going through the side, so it's the longer leg in the dural drag. So that if you have a knee that wants to be always a bit bent, there's a tendency for the weight to get pushed onto the other leg. Okay, so a lot of people when they're standing, they actually have more weight on one side, 55 or 60% more weight going through one side. And then the body then, what it can do is go over this way to try to get the head over the foot. So in that case, push. So if I've got more weight in my left leg, my body's sort of going over this way. I'm not able to see it by a drop in the shoulder on my left side. The head sort of dipping over this way. I push here, I stay straight, and I do the marching with pressure down through this line here. Do that for 2 minutes, check it, and you may find that that knee doesn't feel like it wants to stay bent. The hips have leveled out and it feels like, geez, my weight feels like it's even and there's not this side bend. So that can happen literally that fast. So 2 sets of 2 minutes, really good. 3 sets of 2 minutes, usually find it's a bit better even. So let's do the other side for my own sake as well as yours. So we're pushing hand into the head, not head into the hand because you tend to do this. Hand into your head, long through the spine. Penguin marching, legs stay naturally straight. Your feet stay pulled up. And you may find you can start pushing your hand into your head a little bit stronger as the body gets more calibrated to this. People's bodies do interesting things as they're recalibrating. Some people feel like their body's going to cramp in the lower back, cramping in different areas. It means the body's trying to work out how to coordinate something when it's cramping, doing something like this. So you keep going, the cramping will go away, that feeling will go away, usually within about 10 to 20 seconds. So I'm starting to get fatigued now in the TFL and the glute med muscle here and the glute min a bit too.